Hello and welcome to another episode of the Lancet Voice. I'm Jessamy Bagenal.
And I'm Gavin, Cleaver. On today's show, we're talking about the grim problem of worldwide malnutrition, with the effects of COVID-19 potentially doubling the number of people worldwide in acute food insecurity, according to Dr. Saskia Osendarp, who I'll be speaking with later on.
But first of all, we wanted to discuss dementia. Well, I'm not sure whether we wanted to, but we felt that we should discuss dementia and how life events and choices can alter the risk of dementia. A recent update to our research on dementia added 3 new risk factors for dementia, making 12 total modifiable risk factors, which can account for 40% of dementia cases. I spoke with Professor Gill Livingston of the University of College London about dementia and lifestyle. Gill, thanks so much for joining us today. Perhaps you could just start by telling us a little bit about what your background is and what your role is at the moment.
I'm a psychiatrist by training and by profession. I've been talking to patients before I talk to you today, and I work academically at University College London, where I'm Professor of Psychiatry of Old Age and Head of Department of Mental Health Care of Old Age. Clinically, I work in Camden and Islington Memory Clinic, so I'm very much involved in the dementia field, both clinically and academically.
I'm just going to read the opening sentence to the Commission because I found it so striking, and that's that worldwide around 50 million people live with dementia, and this number is projected to increase to 152 million by 2050, rising particularly in low and middle income countries where around 2/3 of people with dementia live. So are dementia rates going up, or are we just having more people live longer?
Really, more people live longer. So there are more people with dementia. But in fact, in Europe and America, there's consistent evidence that the incidence rates are decreasing. So there will be less people per 1,000 older people with dementia, but many more people with dementia. And one thing that's good news. It means people are living till old age, but we'd like them to live till old age, and fewer people have dementia. So we're glad they're living. Glad to
Yeah, aren't we all? But yeah, good to have less dementia, definitely.
Yeah.
Maybe you could just tell us what's changed since the 2017 Commission on Dementia.
One of the big things I think is in prevention. There's been more and more evidence about prevention since the 2017 Commission. And one of the things that I noticed is that when we launched the 2017 Commission, there were quite a lot of people saying you can't prevent dementia, it's completely ridiculous. There's few people saying that now. There's a real change in attitude with people beginning to understand that you really can make a difference. So I think that the ground is much more fertile and people are much more interested and willing to listen now about it. In terms of one of the things we said in 2017, which surprised everybody, surprised us really quite a lot, was that the most important risk factor was hearing. We didn't expect that. I mean, we did systematic reviews and calculated it, and it came out. So one of the things that's happened since then is a lot of people have done research in this field, and there's been several studies which have looked naturalistically. And I think a really hopeful thing that we didn't know before was that the people who use hearing aids and who have hearing impairment do not have an increased rate of dementia. And that's really hopeful. Now, I know that these are not randomized controlled trials, so it may be that people who use hearing aids are those people who are much better at looking after their health. And it may not be in a randomized controlled trial that we see the same. But I think it's clear that if the people who use hearing aids don't develop dementia any more than everybody else in the population, that the relationship between hearing and loss and dementia is not that they're the same illness showing at different times. And it looks likely that giving hearing aids and encouraging people to use them and making them easier to use might be a relatively simple way to prevent a lot of people developing dementia. So that's a really good thing and a really important thing.
Yeah, that's a fantastic aspect of it. And that kind of sort of just seems like a really easy intervention almost, well, particularly in high income countries that could be used.
That's one. Sorry, go on. You asked me, I've got lots of things that have changed, but you go on to the next thing.
No, I don't want to. I want to hear more about them. You tell me.
Okay, so another thing that's changed is the evidence about high blood pressure, both the level in which we would be trying to get people's blood pressure down to, which is now less than 130 and possibly less than 120 instead of the usual systolic of 140, and the evidence that that really can make a difference. These are randomized controlled trials, but every trial, which usually has cognition and dementia as a secondary outcome rather than a primary outcome, is abandoned because anybody, even the sprint trial, which one group was supposed to be less than 140 and one less than 120, had to be abandoned because those at 120 had so much lower rates of strokes and death. But following up people after that, years later, and we don't know what their blood pressure was, but it had been lowered. There was a significantly lower risk of mild cognitive impairment and dementia together. So that's really hopeful and helpful. So that's a second thing. There is much more evidence, and this is why we added them, about different risk factors. So we were able to add different risk factors like alcohol and head injury. So we added risk factors, and that, working that together, that made an increase in the number of potentially preventable dementia. And that's exciting in itself, that 40% is potentially preventable. We, for the first time, analysed low and middle income countries. And as you mentioned, there are more people with dementia in low and middle income countries and high income countries. We don't expect that, but it's the case. And what we were able to see was that there are more preventable dementias in low and middle income countries than in high income countries. And I think that's really exciting, that is work that hasn't really started, and a lot of that could be done. So that's a really big sort of move forward. We also thought a lot more about physical health, incorporating new evidence, and they're much more tightly bound together, dementia and physical health. So if you have very severe physical health, you develop dementia with less neuropathology, and you develop worse dementia with less neuropathology. And while people's health should be looked after just for itself, trying to help people's physical health with dementia and trying to keep them well should reduce deterioration, and might even possibly be another way into trying to reduce dementia in late life.
I mean, that figure of 40% being, potentially things that you can implement change in to reduce people's risks and to prevent dementia is amazing. I just wanted to kind of talk more about these three extra kind of modifiable factors that you'd added in of alcohol consumption, air pollution, and traumatic brain injury. And I guess just in terms of kind of, patients thinking, what is the safe level of air pollution? What is the safe level of alcohol consumption, to which you can say, well, I'm modifying my risk for dementia. What is the evidence around that, and where are the kind of cutoffs, or do we not know yet?
Well, we know about alcohol that if you compare people who drink more than 21 units a week, which in American is 14 drinks, compared to people who drink less than 14 units a week, then the rate of dementia is increased. So we've really got a cut point. I don't think we're at the stage yet when we have a cut point with pollution. We're very much in the more pollution is more bad for you area. We looked at all the pollution studies for both cognitive impairment and dementia and systematically reviewed them, and all of them were consistent that pollution makes you more likely to develop dementia, and that's interesting in itself. Now, you may think, and I certainly think, that being in a heavily polluted area is a marker actually for other forms of deprivation. But when we look at animal models, animals develop tau pathology, rodents develop tau pathology if they're in a polluted area. So it does look like there's a direct biological link, although people people who are in heavily polluted areas probably don't want to be there and may have lack of choice in their life. And we don't have a safe level. And I think that individuals, there's relatively little that you can do. But I mean, I've looked at a map personally for pollution, and Tottenham Court Road, which is where I work, is about the highest, most polluted area in London. So, or where I work when it's not COVID. And, but even going a few streets back really makes a difference to the pollution levels. So I think that personally we can do that, but mostly thinking about pollution is a governmental intervention. The other thing about pollution is because everyone did it in a different way, we couldn't do what we would regard as in any way a valid meta-analysis. So our figures are looking from Canada, and actually Canada is one of the least polluted areas in the world. So we're probably underestimating for most of the world the effect of pollution.
For those of the listeners, my 3-year-old son has just come in, so you did amazingly well to carry on your answer there, because he's interested in killing ants downstairs, it seems. Anyway, what I found really incredible about the Commission is that it illustrates sort of what a whole of society problem dementia is. From air pollution to education. And I just wondered whether you might be able to tell us a little bit more about that kind of early life education and the future dementia risk issue.
I think it's really interesting what happens in terms of education and dementia, because people who have more education are less likely to develop dementia, but it's not that they are less likely to have the neuropathology. So if you look at post-mortem, they're just as likely to have the neuropathology, but they're more resilient to the neuropathology, and it has less effect. So basically what you're doing with early life education is you're building up a much more resilient brain, which can cope with, so that's what we call cognitive reserve. And since the 2017 Commission, there's evidence that we looked at 13 as a cut point, but it's evidence that up to age 20, you continue to build this resilience. We don't have figures as to how much difference, but that's continuing education in younger people who have a plastic brain seems really important. Then after you're age 20, when you're an adult, people who do more cognitively stimulating things are more protected. People who retire later are more protected than those who retire earlier. And that's not just in terms of that people who retire earlier might be sicker, because if you look at the country retirement age, that makes a difference. So it's a policy thing as well. It probably has less effect when you're an adult as to how much, as to the difference it makes, and because your brain is probably less plastic, but it continues to have an effect. So it's a really important message about continuing to be cognitively active. And I don't mean doing brain training apps. I mean doing lots of different things to develop your whole brain and keep your whole brain moving. And will not only make your life more fun and probably protect you a bit from depression, but also will make you less likely to develop dementia.
Yeah, and I guess it is those kind of more rounded types of activities that are gonna help then. And I mean, I don't know what the evidence is behind just socialising as well, and doing that in groups and out of groups.
Yeah. Well, that's another thing, that there's been a great increase in the evidence, and that socialising by itself seems to make you so roundabout, so age 40, 50, 60, which is the times that people have looked at, makes you less likely to develop dementia. So having social contact is really helpful, not necessarily doing particular things, but just socialising. And socialising is a really cognitively demanding thing. You have to pay attention to other people, listen to them, often in a group take on board what other people are saying, and respond to them, and you don't know what they're going to say. So socialising is cognitively demanding, and is obviously an interaction between hearing and socializing. So if you can't hear, you avoid seeing a lot of other people because you can't socialize with them properly. So the evidence about socializing is much stronger than it was, and it seems really important. And it's interesting that cross-culturally, wherever you look, it has a similar effect size and a similar effect. So wherever you are, try and see other people if you can and chat to them.
Yeah, go and have a cup of tea. Get out of the house if you can because of COVID-19. Or Zoom.
Or maybe talk to people in your house if you can't get out.
Exactly. And I guess with COVID-19, inequality is sort of on everybody's mind. And I was just wondering whether you could tell us a little bit about how tackling inequality may improve dementia risk, and treatment ultimately.
So how equality may,
in like tackling inequality can
absolutely. If you look, and as you said, it's really extremely obvious when you look at the risk factors how societal they are. It really makes a difference how society is set up. And if you are living in an area where it's difficult to walk around and there aren't any shops, then you're likely to be obese, you're quite likely to be hypertensive, you're quite likely to develop diabetes, and you're quite likely to have low exercise. All of these things are risks. And while there are things that things you can make a difference to individually, it's much more difficult. I mean, within COVID, while people have been in the house, a lot of people have put on weight because they're living in a different way. And the way that society is set up really makes a difference. And I talked earlier about the decrease in dementia. And the interesting thing is that these decreases tend to be in people who have more education and more resources. And the inequality in society, the way that people don't have the opportunity to live a healthy life really makes a difference, not just in the life that they're living now, but whether they'll develop dementia in the future.
It's fascinating. Terrifying in some ways that there's so much to do.
So much to do, but really wonderful that as people in Western nations have smoked less, and as they have had more education and their blood pressure has been more controlled, you can see that dementia has dropped. And interestingly, it's really men that have smoked less, and there's much less effect in women than there is in men. It's wonderful to see a change, because I think when I started the work in dementia, it didn't occur to me that this would happen. And it would be wonderful if Lancet and the Commission is part in driving through future change that will make things better for individuals and their families and society.
I'm sure it will do. That seems like a great place to end, unless there's anything else that you would like to kind of say or add or make sure that we cover.
No, I think that's a pleasure talking to you. A good place to end.
It was a real pleasure talking to you. Thank you so much for joining us.
All right, and thank you. Bye now.
Bye-bye. Bye.
I think what's so interesting about the Dementia Commission is it's really just brought back into focus that there are modifiable risk factors. So many of us think that dementia is just sort of an inevitability almost of old age, and that there's nothing that you can do about it. And I was reading actually that Cicero, 2,000 years ago, was the first one to kind of suggest that actually you can prevent cognitive decline by keeping, an active mind and doing things. And I think that's what is so great about the commission, is that, it just sort of really highlights what you can do to reduce your risk.
Do you often go back to the works of Cicero for your research?
I do. I go back to the works of Cicero on a daily basis, probably, Gavin.
I don't think that's true, is it? But nevertheless, aside from Cicero, it is fascinating to think about how much dementia and, in that sense, long-term suffering can be avoided through these modifiable risk factors, and how, of course, that this is going to become more and more and more of an issue as life expectancy increases, as general populations age, as the birth rate decreases, and we have to support more and more older people as a society, this is going to it's only going to become more and more of a problem.
Yeah, and I think what sort of particularly struck me is just the burden that is on lower and middle income countries, and how that's rising much faster than high income countries because of the increases in life expectancy, and just the fact that it's something where we just seem very unprepared for that huge potential increase in these growing countries.
Yes, it's one of those things, really, isn't it, where we're only really still at the prevention stage. The treatments for it are so underdeveloped that it's really just a kind of case of coping with the burden. And these are some ideas that could actually help reduce the impact of dementia on society. I was particularly interested. You and Gill talked at length, I think, about air pollution and air quality and ventilation and that sort of thing. And that's become a theme a lot recently, talking about COVID-19, of course, as we always talk about, but also thinking about the state of cities and air quality there, and how we might want to change things following the pandemic. And of course, as we were talking about in a recent episode to do with public transport, how we're going to have to alter things there to do with ventilation and air pollution. It's just really fascinating to think how actually not only does air pollution and ventilation tie into current health in terms of lung damage and infectious diseases, but also it has these really deleterious long-term effects as well.
Yeah, there's a growing body of evidence that air pollution has, many, many, many effects on all of our bodies. And that is intuitive for us. Of course, we think that should be right. But actually getting the empirical data is slightly trickier. So it's nice in a way to have this down as a risk factor for dementia. I mean, that conversation that we had, I'm not sure it's hugely helpful for patients, because it's not like you can say, well, I live just outside London, is that going to reduce my risk of dementia or not? Maybe I live next to the M40 or whatever. But at least we're alive to the subject now.
Yeah, absolutely. And I think it's something that's becoming more and more prominent. And in fact, I remember just after I started at the Lancet, I was in a meeting with our deputy editor, and we were talking about air pollution, and she said, as anyone who's conducted lots and lots of autopsies knows, and at that point, obviously, my attention was piqued, she said, anyone who's lived in a city, if you cut them open, their lungs will be black. And that's kind of struck with me. That's kind of stayed with me ever since. It was so striking.
That's surprising that such a vivid image would stick with you, Gavin. I mean,
right? Yes.
Was that your introduction to the Lancet? Just discussion about chopping bodies open.
Yeah, I think that was
now
the first
when you're
3
cycling
months,
around, you've just got it there.
I'd just come to the Lancet from working at a food magazine, and the meetings are quite different. Back to dementia, briefly. It's interesting as well. We're talking about pollution, but pollution and so many other of these modifiable aspects are burdens that fall on people who. Sorry, I'll start that again. I felt I got some water here. There we go. I shouldn't cough in the office. I'll be thrown out. So, talking about pollution and these other modifiable risk factors, they're so often things that have a greater burden of them falls on people who already suffer from the effects of inequality. Air pollution, lifestyle risk factors like obesity, hypertension, those sort of things. These things already have an impact on those. On the worst off members of society. So it's just another one of those things. And it seems like we come back to it in every single discussion, in almost every single paper we publish that talks about public health and global health, that the worst effects of these things fall in an unequal burden on the worst off of society and around the world.
Yeah, and I suppose, this is a call to action in many ways for those things that are straightforward, like education, like smoking, like obesity. They're simple public health interventions that we do know how to do. The majority of the gains in life expectancy of the sort of latter part of the 20th century were made because we managed to reduce smoking, we managed to reduce cardiovascular problems. So we do know how to do these, and it's just a case of making sure that it happens for everybody rather than just, the top 10% of the wealthiest people around who are able to keep fit and have hearing aids and get well educated and do exercise.
The COVID-19 pandemic isn't just about infectious disease. During the first major pandemic in a century, we're really only just beginning to understand the manifold effects of a pandemic on already existing problems around the world. One of those is malnutrition.
And I think we just wanted to clarify what malnutrition refers to, and that's deficiencies, excesses, or imbalance in a person's intake of energy and or nutrients. And it covers quite a broad range of issues, including micronutrient malnutrition and overweight and obesity. But here you'll hear a lot of the word wasting, and that comes under the undernutrition sort of factors for malnutrition. And that's essentially low weight for height. There's also things like stunting and underweight, but here it's mainly focusing on wasting.
So before COVID-19, there was 47 million children under 5 who were moderately or severely wasted due to malnutrition. New research suggests that the effects on food supply of the pandemic will make these effects much, much worse. So I spoke with Dr. Saskia Osendarp, who's the Executive Director of the Micronutrient Forum, about these latest estimates. And we talked about how COVID-19 is exacerbating food inequality and driving malnutrition. Dr. Saskia Osendarp, thank you so much for joining me today. It's a real pleasure to have you.
Sure, thank you.
So we're talking about your comment that was recently published in the Lancet on child malnutrition and COVID-19. So I guess kick us off then by explaining what specifically is it about COVID-19 that affects child malnutrition?
Yeah, so the COVID-19 crisis actually combines 3 different shocks that are affecting child malnutrition. The first is that particularly due to the containment measures, we see disruptions in the delivery of essential nutrition services to children and pregnant mothers. And this has been reported now by UNICEF that on average in the first months of the COVID crisis, they saw a reduction in coverage of essential nutrition and health services of about 30%, which could go down to 75 to 100% in some contexts during the real lockdown phases. And we know from previous crises that it may take about a year before that will go back to normal levels. So that means that children are derived from essential services such as vitamin A supplementation, breastfeeding promotion, and mothers during pregnancy are derived from essential maternal nutrition interventions and micronutrient supplements. And in combination with that, we see a food systems crisis. Food prices have soared. The availability, particularly of nutritious foods, is affected, particularly in urban areas, making it more and more difficult for children and their families to have access to healthy diets. And on top of that, there's a socioeconomic crisis. And we have used for our projections the projections of the World Bank in April that for individual countries, but that on average projected a 7.9% decrease in incomes in 2020. We've brought together a group of scientists from the nutrition fields, the health fields, and the food systems fields, because we knew that this was not, this was such a complex crisis, to project what would be the combined impact of all these shocks on child malnutrition. And what we saw first was that this would result in an additional 14% increase in child wasting. So that would result in an additional 6.7 million children who would become wasted in 2020 alone. And we know that severe wasting is one of the most important causes of death among children in low and middle income countries. So combined with the decreases in coverage that we see in essential nutrition and health services, this would result in an additional 129,000 child deaths before the end of the year, and that's an increase of 10,000 deaths per month. So that's a very significant effect, and that's just the top of the iceberg, because we know when this crisis will last for longer, and the full impacts on social protection programs, on food systems and health systems will come out, that we will see other forms of malnutrition being affected as well, including stunting, chronic malnutrition, and micronutrient malnutrition.
So before COVID-19 hit, if you can remember back that far, where were we in making progress on tackling child malnutrition worldwide? And so how much has this set us back?
Yeah, so before COVID-19, we were actually doing reasonably well in child malnutrition. We saw improvements in the percentages of children that were stunted, in particular, some smaller improvements in children that were wasted, which is acute malnutrition, and in some of the maternal nutrition and birth outcomes indicators. Although, of course, we were not on track yet to meet the goals that the world has set itself in 2030 to reduce all forms of to eliminate all forms of malnutrition. So basically, what we see happening now with COVID. So before COVID, we saw there was a projected 47 million children to be wasted in 2020. We now see that COVID might result in an additional 6.7 million children wasted, and that will potentially could mean that by 2020 we will be at levels that we have not seen in the last 20 years. That basically means that the progress we've made in the last much of the progress we've made in the last 2 decades could be lost by the end of this year. And I think that's also the reason why everyone is now so worried and is behind this call to action, because we really need to have urgent actions to prevent this from happening.
So it's very serious. Obviously, the as you said, the rolling back kind of the last 2 decades of progress on child malnutrition. So what's being done as a result of child malnutrition caused by the COVID-19 pandemic? And what do you think needs to be done in kind of the near future to kind of help gain back some of this progress?
Yeah, so the in the call to action that was published last week by the 4 UN directors, they urged the international community to invest in nutrition now, and they highlighted 5 priority actions that really need to be implemented straight away in order to prevent this from happening in 2020. And these 5 actions include to safeguard and promote the access to nutritious and healthy diets. And that could be done, for instance, by taking measures such as food vouchers for poor families, or price policies to reduce the cost of a healthy diet, but also making sure that trade barriers are selective and still allow the import of nutritious foods to markets, or the import of premixes that are needed to fortify foods when diets are not sufficient. It also includes to invest in essential nutrition services through health systems, by making sure that these services can be delivered in a safe way, by protecting health workers, providing sufficient equipment for health workers during the crisis, as well as for food systems workers, by the way. And these include services such as vitamin A supplementation, the promotion of breastfeeding and infant feeding. It includes the treatment of wasting, children and the prevention of wasting. And it also means that countries should invest in the continuation of school feeding. We know that many children are dependent on school feeding programs. And of course, with schools closing down because of the pandemic, these programs are severely disrupted. So there's a call to look for other means of ensuring that children have access to these additional meals. And it includes the expansion of social protection programs, such that they can include the access to healthy diets as well. Yeah, so I think that's what is needed now. And then when the crisis continue, we really need to invest in improvements in these essential nutrition programs, as well as improvements in making sure our food systems are able to resist similar shocks in future, and that this crisis will not result in a further inequity in the access to healthy foods and healthy diets that we have seen before. We also know that the other forms of malnutrition that will also be affected, as well as the fact that we now have pregnant mothers being affected, which results in children being born. We know that children that are malnourished early in life will have difficulties later in school. So it will affect their learning capacities. It will affect their risks of chronic diseases and obesity later in life, as well as their ability to have a productive adult life, and eventually it can even affect a country's GDP. So it's really social capital that's at stake here for the future generations as well.
Okay, so we're obviously COVID-19 will be over eventually, and hopefully some of the things we can put in place can get us back on track with child malnutrition. It might take a while, but hopefully we'll get there eventually. But what are some of the things we could do to guard against future pandemics, to guard against this kind of thing happening again?
When it comes to future pandemics, from a child malnutrition perspective, we really need to make sure that our food systems are more resilient to these kind of shocks, as well as the delivery of healthcare services. Obviously, we've never seen this happening before, that countries went into entire lockdowns, and which also meant that these services were disrupted to the extent that we've seen during the COVID pandemic. I don't think we are arguing against lockdowns and social security measures, because they really needed to prevent the further spread of the pandemic. But we have to make sure that the delivery of essential services is being protected in future pandemics. We also have to make sure that our food systems rely on maybe shorter supply chains and rely on more domestic productions as well, and that there are social protection systems in place that can help when food systems collapse during future pandemics, that can help then for the low-income families especially to continue to have access to nutritious foods.
Okay, I mean, there's a lot to take in there. It's incredibly important work, and thank you so much for talking about it with me today.
Thank you.
So it's fascinating to talk to Saskia there, and obviously it's such a depressing thing to think about, losing 2 decades of progress on malnutrition and wasting in one fell swoop due to the pandemic. And it really, again, as we just talked about, it really highlights how COVID-19 is disproportionately affecting those who are worst off around the world. We in the current issue of the Lancet, our lead editorial discusses this, where we talk about more broadly, malnutrition falls under it, but more broadly, humanitarian crises around the world, as well as malnutrition, talking about displaced populations, refugees, people at risk from climate change, things like that. Even before this year started, as we mentioned in the editorial, UNOCHA predicted that 1 in 45 people on the planet would need humanitarian assistance this year. And that's before you consider the effects of the pandemic on people in low-income settings. It's very depressing to think about. It's truly horrible. There's a lot of work that needs doing, but governments currently are dealing with their problems internally before looking outwards. So it's a bleak picture, basically.
The figures are shocking. I mean, 6.7 million children wasted, which is going to result in an additional 10,000 child deaths per month in the first 12 months, and 80% of those are going to happen in low and middle income countries. In India alone, 150 million children are now at risk of malnutrition due to the disruption of the world's largest lunch program. But it's not even just lower and middle income countries. In the US, 1 in 5 children live in poverty, and 30 million of those children receive the childhood school nutrition programs, which have obviously been hugely disrupted over COVID-19. So it's one of those fundamental issues where the knock-on effects are so large, because undernutrition for children particularly makes them, at a much increased risk of infection. So even before COVID-19, 1 in 10 child deaths under the age of 5 in lower and middle income countries were due to wasting. So having poor nutrition, the long-term consequences, as you discussed during that interview, are so long and so multifaceted.
Yes, it's really, malnutrition in childhood causes so many knock-on effects throughout life in an individual and across societies that those individuals are present in. That it really makes me think that this is the first pandemic in a century, and we're really only just beginning to understand the effects of the pandemic and things that have been caused by the pandemic, such as lockdowns and emergency public health measures. We're only really beginning to just about understand the effects these are having on people's health that have nothing to do with COVID-19. All these programs being disrupted around the world, people's livelihoods being affected, distribution of food and medicines being affected. It's such a vast and difficult to take in subject area that it really feels like you could do a PhD thesis on a tiny area of it, and understanding the incredible complexities of these systems feels overwhelming.
Well, I think there are some really interesting things that it's highlighted about our lack of evidence, and how, there are lots of issues in the world that have sort of deteriorated, and inequalities have been increased over the last 20 to 30 years, and systems that are in place have not had the sort of proper funding or proper research into how they're working and what the consequences are for individual countries, that we are in no man's land in a lot of areas. And so, things like food security, things like our food systems, there just hasn't been the kind of focus necessary to really understand, which countries are sort of requiring, how many countries. I was looking at the data before in terms of, which countries require imported food and that sort of thing. And, a lot of the data on the World Bank, they've collected it and that's great, but some of it is very old. Some countries don't have anything from 2015, since before 2015. So, just sort of having a good grasp on how countries are importing food and what proportion of their total national intake requires, food from other areas, and how those systems are in place. We just haven't been focusing on that. We don't have the research. We don't have the evidence for those things. And this is just one example of many things which have gone under the radar, really, and nobody's focused on. And now they are so crucially important because they have the, possibility of making many millions of people's lives in, a really terrible state.
I think in a way you almost have to hope that this is the dress rehearsal of a pandemic. Do you know what I mean? We've talked so much over the last few months about how there are more pandemics to come, how this will absolutely not be the last one. You have to hope that we, as a planet, speaking grandly, I suppose, will learn from all of these mistakes. We'll learn where the gaps are. We'll learn where the research is that we needed, the data that we needed, the evidence that we needed, and we'll learn how to better supply and cope for the worst off around the world for the next one. But it's a lot to take on, isn't it?
Well, it is. And at the moment, with a complete lack of any global leadership, we still haven't had a global meeting of countries to sit down in some kind of emergency forum, like either the UN or anything else, to discuss these issues. We haven't had that. I mean, it really beggars belief that we haven't had that kind of global leadership, that kind of global collaboration. Without that, it falls on WHO, but WHO is being defunded. People aren't listening to it. So it is a scary place to be. Yes, we hope that the world will learn from this and try and, implement some ways of rectifying the problems that the sort of COVID-19 has shone a light on. But without any global leadership, it's not looking good.
No, I think the lack of global cooperation has been glaring. I mean, there's a great statistic to illustrate it, which is that the UN estimates that its COVID-19 humanitarian response plan would cost the world $10.3 billion. It's only been 20% funded by countries around the world, but the total that countries have now spent on stimulus for their economies during this pandemic is $10 trillion. So 1,000 times what would be needed to fund this plan, which is still only 20% funded. So hopefully one of the lessons that the world will take from this is that the need for greater global cooperation is overwhelming, and it's something that the world has absolutely flunked this time.
Yeah. And, you know, the fact that this sort of knee-jerk response that we've had to so many things, I mean, of course, we need recovery programs at a national level, but, you know, if governments had the headspace and the leadership to be able to take a step back and think about the most effective and efficient ways to do those within a sort of more global context, then, you know, we might not be spending money in the ways that we are, which may not be having the most effect.
Thanks for listening to this episode of The Lancet Voice. We'd love to hear your feedback, and you can reach us through the email address podcast@lancet.com. We'll see you again next time.